6 fruits to avoid for leg cramp relief in older adults. Have you ever woken up in the middle of the night with a painful leg cramp? You may have tried everything: magnesium supplements, staying hydrated, regular exercise, yet the problem persists. What you may not realize is that some of the fruits you eat daily could be exacerbating the issue. Today we'll explore 6 seemingly harmless fruits that can worsen leg cramps, particularly in older adults. Watch until the end to see if you're consuming any of these fruits. 1. The bananas are overripe. Nutritional changes in overripe bananas. As bananas ripen, starch breaks down into simple sugars. The complex carbohydrates in bananas gradually transform into glucose, fructose, and sucrose. This makes overripe bananas sweeter and increases their glycemic index, GI. A high GI means blood sugar levels rise rapidly after consumption. The impact on blood sugar and dehydration. When blood sugar rises sharply due to overripe bananas, the body responds by releasing insulin to lower blood sugar levels. This subsequent drop in blood sugar can lead to dehydration, as insulin causes the kidneys to excrete more water. Dehydration is a major contributor to muscle cramps in older adults, as water is crucial for maintaining normal muscle function. Dehydration not only diminishes the body's overall water content but also disrupts electrolyte balance, particularly impacting potassium and magnesium. These vital minerals are crucial for maintaining normal muscle contraction and relaxation. Significant potassium loss, often through urination, can render muscles more susceptible to spasms, thereby increasing the frequency of muscle cramps. This electrolyte imbalance can have far-reaching consequences, affecting various bodily functions beyond muscle activity. Maintaining adequate hydration is therefore essential for preventing this potentially debilitating condition and ensuring optimal bodily function. The severity of electrolyte imbalance is directly correlated with the degree of dehydration, highlighting the importance of prompt rehydration strategies when experiencing even mild dehydration symptoms. Furthermore, individuals with pre-existing conditions affecting electrolyte balance, such as kidney disease, should be particularly vigilant about maintaining proper hydration levels to mitigate the risk of serious complications. Overripe bananas may contribute to water retention in some individuals, impacting blood circulation. Excess fluid accumulation can impede the efficient flow of blood, potentially depriving muscles of the necessary oxygen and nutrients for optimal function. This reduced circulation can exacerbate muscle cramps, particularly in older adults who may already experience circulatory challenges. The impaired delivery of vital nutrients and oxygen due to compromised blood flow can lead to muscle fatigue and discomfort, highlighting the importance of consuming bananas in moderation, especially for those with pre-existing circulatory conditions. While bananas offer numerous health benefits, mindful consumption is key to preventing potential negative effects on circulatory health. Consulting a healthcare professional is advisable if you experience persistent muscle cramps or circulatory issues. Solution: which ripeness level of banana should you consume? It's recommended to opt for bananas that are slightly underripe or just turning yellow. This is because they contain lower levels of sugar, they still provide ample potassium and other beneficial minerals, and they avoid a sudden spike in blood sugar and subsequent dehydration. Furthermore, overripe bananas can be substituted with other potassium-rich yet lower sugar alternatives such as sweet potatoes, avocados, and spinach. These options offer a similar nutritional profile without the potential drawbacks associated with excessively ripe bananas. Careful selection of banana ripeness, therefore, contributes to a healthier and more balanced dietary approach. 2. Grapes. Grapes are a nutritious fruit rich in vitamins, minerals, and antioxidants. Key components include carbohydrates, primarily natural sugars such as glucose and fructose, vitamins C, K, and B6, minerals like potassium, magnesium, and calcium, and antioxidants such as resveratrol, flavonoids, and quercetin. While generally a healthy food, excessive consumption or improper intake may contribute to cramping in older adults. Grapes and their potential influence on muscle cramps. While grapes offer numerous health benefits, excessive consumption may contribute to muscle cramps through several mechanisms. High sugar content and dehydration. Grapes are naturally rich in sugars, primarily glucose and fructose. Consuming a large quantity triggers insulin release to process this sugar influx. This process can lead to mild dehydration, as insulin stimulates the kidneys to excrete water through urine. Dehydration is a well-known contributor to muscle cramps and spasms, particularly affecting older adults with potentially less efficient circulatory systems. Impact on electrolyte balance. Grapes contain potassium, a crucial mineral in preventing muscle cramps. However, they also possess a significant concentration of organic acids, tartaric, malic, and citric acids. Excessive intake, especially of unripe grapes, may lower blood calcium and magnesium levels, disrupting electrolyte balance and potentially inducing cramps. This imbalance disrupts the delicate equilibrium necessary for proper muscle function. Gastrointestinal effects and mineral absorption. Grapes contain substantial amounts of fiber and tannins, which can cause digestive upset, including diarrhea, if consumed in large quantities. Diarrhea leads to fluid and electrolyte loss, impairing muscle function and increasing susceptibility to cramps. The body's ability to absorb essential minerals for muscle health is compromised during episodes of diarrhea. Influence on blood circulation. Grapes possess mild blood-thinning properties attributed to resveratrol, a compound that can improve blood circulation. However, in older individuals with pre-existing low blood pressure, excessive grape consumption might excessively lower blood pressure, potentially causing temporary muscle ischemia, reduced blood flow, and resulting in cramps. This effect highlights the importance of moderation, particularly for individuals with pre-existing circulatory conditions. Consulting a healthcare professional is advisable for those with concerns about the impact of grape consumption on their health. Solution: how to eat grapes to avoid muscle cramps. To enjoy the benefits of grapes without experiencing muscle cramps, older adults should consider the following. Consume grapes in moderation, approximately 10 to 15 grapes per day, to prevent sudden blood sugar spikes. Drink plenty of water after eating grapes to prevent dehydration. Combine grapes with foods rich in magnesium and calcium, such as almonds, yogurt, and leafy green vegetables, spinach, kale. Avoid eating grapes on an empty stomach or at night, as this can cause indigestion, affect sleep, and increase the risk of nighttime muscle cramps. 3. Orange, overused. Nutritional composition of oranges. Oranges are rich in essential nutrients, including vitamin C, ascorbic acid, which supports the immune system and promotes healthy skin, citric acid, contributing to their tart flavor and aiding digestion, dietary fiber, pectin, which helps regulate blood sugar and supports digestive health, and minerals such as potassium, calcium, and magnesium, vital for maintaining electrolyte balance. They also contain carbohydrates, primarily natural sugars like fructose and glucose. While oranges offer numerous health benefits, excessive consumption may lead to negative health consequences. Excessive consumption of oranges, potential health risks, and mitigation strategies. Digestive issues. Oranges are rich in citric acid, which when consumed excessively can irritate the stomach, potentially worsening acid reflux, heartburn, or gastritis. Their high fiber content may also cause diarrhea or abdominal pain, especially when consumed on an empty stomach or in large quantities. Solutions: avoid drinking orange juice on an empty stomach or immediately after meals. Refrain from consuming orange juice in the evening to prevent potential nighttime acid reflux. Increased risk of kidney stones. The high oxalic and citric acid content in oranges can increase the risk of kidney stone formation, particularly in individuals with a history of kidney problems. Excessive vitamin C intake can also be metabolized into oxalate, a compound contributing to kidney stone development. Solutions: maintain adequate hydration to support the kidneys in eliminating excess acid. Limit orange juice consumption to less than 500 milliliters per day if you have a history of kidney stones. Impact on blood sugar. Oranges contain natural sugars, and excessive consumption can elevate blood sugar levels, especially in individuals with diabetes or insulin resistance. While having a lower glycemic index than many processed soft drinks, large quantities of orange juice can still lead to rapid blood sugar spikes. Solutions: individuals with diabetes should limit orange juice intake, opting instead for whole oranges to benefit from fiber and slower sugar absorption. Consume unsweetened orange juice to avoid sudden blood sugar increases. Electrolyte imbalance. Oranges are high in potassium. Excessive consumption can lead to hyperkalemia, high blood potassium, resulting in fatigue, irregular heartbeat, and muscle weakness. This is particularly risky for individuals with kidney disease, as impaired kidneys struggle to eliminate excess potassium. Solutions: limit orange juice consumption to no more than 250 ml glasses 500 ml daily to avoid excessive potassium intake. Consult a physician before regularly consuming oranges if you have kidney disease. Enamel erosion. The citric acid in oranges can erode tooth enamel, increasing sensitivity and susceptibility to cavities. Continuous consumption without rinsing or brushing can significantly damage tooth enamel. Solutions: use a straw to minimize contact with teeth when drinking orange juice. Rinse your mouth with water after consuming orange juice to neutralize the acid. The recommended daily intake of oranges. To enjoy the benefits of oranges without experiencing adverse effects, adults should consume a moderate amount, 1 to 2 oranges per day or 250 to 500 milliliters of orange juice per day is recommended. Individuals with stomach, kidney, or diabetic issues should limit their intake and consult a doctor for personalized advice. 4. Watermelon. Watermelon nutrition. Watermelon is rich in beneficial nutrients, including water over 90%, provides hydration and a cooling effect. Natural sugars, fructose, glucose, sucrose, offer a quick energy boost. Vitamins and minerals. Vitamin C strengthens the immune system and promotes healthy skin. Vitamin A, beta-carotene, supports eye and skin health. Potassium aids in electrolyte balance and cardiovascular health. Lycopene, a powerful antioxidant that protects the cardiovascular system and may help prevent cancer. Fiber promotes healthy digestion. While watermelon offers numerous health benefits, excessive consumption may lead to some health issues. The effects of excessive watermelon consumption. Digestive disturbances. Watermelon's high water content can lead to bloating, distension, and diarrhea if consumed excessively, as the digestive system may struggle to absorb the excess water and sugar. The high natural sugar content can also disrupt the gut microbiome, causing digestive upset in individuals with sensitive stomachs. Solutions: consume watermelon in moderation. Avoid overeating. Do not eat watermelon immediately after meals to prevent bloating. Blood sugar impact. Watermelon has a relatively high glycemic index, GI 72, meaning its sugar is rapidly absorbed into the bloodstream, potentially causing a sudden spike in blood sugar, especially when consumed in large quantities. Individuals with diabetes or insulin resistance should be cautious, as excessive watermelon consumption can lead to blood sugar fluctuations and increase the risk of diabetic complications. Solutions: diabetics should limit watermelon intake to small portions, 100 to 150 grams per serving. Consume watermelon with protein-rich or high-fiber foods, such as yogurt or chia seeds, to slow down sugar absorption. Electrolyte imbalance risk. Watermelon's high potassium content can lead to hyperkalemia, high blood potassium, if consumed in excess, resulting in fatigue, irregular heartbeat, and impaired kidney function. Individuals with kidney disease should limit their watermelon intake, as weakened kidneys may not effectively eliminate excess potassium. Solutions: do not consume more than 500 grams of watermelon per day if you have kidney or cardiovascular issues. Blood pressure effects. The lycopene in watermelon has vasodilating properties and can lower blood pressure. Excessive consumption may cause hypotension, low blood pressure, leading to dizziness and fatigue. Individuals taking blood pressure medication should be mindful, as watermelon may enhance the medication's effects, potentially causing excessive blood pressure reduction. Solutions: if taking blood pressure medication, consume watermelon in moderation. Kidney impact. Watermelon has a diuretic effect. Excessive consumption can overwork the kidneys in filtering water and potassium. Individuals with kidney impairment may struggle to eliminate excess potassium, increasing the risk of acute kidney failure or cardiac arrhythmias due to hyperkalemia. Solutions: limit watermelon intake if you have kidney disease or edema, swelling, due to kidney failure. Abdominal discomfort. Watermelon is considered a cooling food. Excessive consumption, especially on an empty stomach or in the evening, can cause abdominal pain, chills, and diarrhea. Individuals with sensitive digestive systems, gastritis, or a tendency towards cold sensitivity should limit their intake. Solutions: avoid eating watermelon in the evening or on an empty stomach. Individuals with weak stomachs should consume small portions, 100 to 200 grams per serving. The recommended daily intake of watermelon to maximize its benefits without experiencing side effects is 200 to 400 grams. Consuming more than 500 grams daily is not advised, especially for individuals with kidney, cardiovascular, or diabetic conditions. Those taking blood pressure medication or experiencing digestive issues should consult their doctor before increasing their watermelon consumption. 5. Cherries are rich in vital nutrients, including antioxidants, anthocyanins, quercetin, melatonin, and lycopene, which protect against aging, inflammation, and disease. They also provide essential vitamins and minerals, such as vitamin C, boosting immunity and benefiting skin health, vitamin A, beta-carotene, supporting vision and skin, potassium, regulating blood pressure and electrolyte balance, and fiber, aiding digestion and gut health. Furthermore, cherries contain melatonin, which promotes sleep and reduces stress. However, due to their natural sugar content and certain bioactive compounds, excessive cherry consumption may have adverse health effects. Excessive cherry consumption can lead to several adverse effects. Digestive issues. Cherries are rich in soluble fiber and sorbitol, a natural laxative. Overconsumption can cause bloating, flatulence, and diarrhea due to the body's inability to process excess fiber and sugar. Individuals with sensitive digestive systems may experience abdominal pain and indigestion. Solution: consume only 10 to 20 cherries at a time to minimize side effects. Avoid eating cherries on an empty stomach to reduce intestinal irritation. Elevated blood sugar. While cherries have a moderate glycemic index, GI 63 to 70, their fructose and glucose content can still elevate blood sugar levels if consumed excessively. Diabetics and those with insulin resistance should limit their cherry intake to prevent sudden blood sugar spikes. Solution: diabetics should consume cherries in small quantities, 5 to 10 cherries at a time. Combining cherries with protein-rich foods like yogurt or healthy fats like chia seeds can slow down sugar absorption. Digestive issues from cyanogenic glycosides. Cherry pits contain amygdalin, a compound that can metabolize into cyanide. Accidental ingestion or chewing of cherry pits can lead to cyanide poisoning, causing nausea, dizziness, and headaches. However, significant risk only arises from chewing numerous pits, therefore exercise caution. Solution: absolutely avoid chewing or swallowing cherry pits. Supervise children while they are eating cherries to prevent pit ingestion. Potassium imbalance. Cherries contain potassium, essential for electrolyte balance and cardiovascular health. However, excessive consumption can lead to hyperkalemia, high blood potassium, particularly in individuals with kidney problems. Symptoms include fatigue, muscle weakness, and irregular heartbeat. Solution: those with kidney or cardiovascular disease should consume cherries in moderation, under 200 grams per day. Allergic reactions. Some individuals may be allergic to cherries, experiencing symptoms such as oral itching, lip swelling, hives, and difficulty breathing. Cherry allergies are often linked to oral allergy syndrome, OAS. Solution: if you have a history of pollen allergies, try a small amount of cherries to check for any reaction. Seek immediate medical attention if severe allergic symptoms occur. Drug interactions. Cherries contain quercetin, an antioxidant that may affect the liver's drug metabolism rate. Certain medications, such as blood thinners, warfarin, non-steroidal anti-inflammatory drugs, NSAIDs, or diabetes medications, may be affected by excessive cherry consumption. Solution: consult your doctor before regularly consuming cherries if you are taking any medication. To enjoy the benefits of cherries without experiencing any adverse effects, moderate consumption is recommended. A daily intake of 10 to 20 cherries is generally suitable for healthy individuals. However, if you have digestive, kidney, cardiovascular, or diabetic concerns, limiting your consumption to fewer than 10 cherries per day is advisable. To avoid digestive upset, it's best to avoid eating cherries at night or on an empty stomach. 6. Pineapple nutrition. Pineapple is rich in essential nutrients, including bromelain, an enzyme that aids protein digestion, reduces inflammation, and supports immunity. Vitamin C, which boosts immunity, benefits the skin, and acts as an antioxidant. Vitamin B1, thiamine, which supports energy metabolism and nerve function. Manganese, which promotes bone health and enzyme function. Dietary fiber, which aids digestion and improves gut health. and natural sugars, which provide quick energy. While offering numerous benefits, excessive pineapple consumption may lead to certain health issues. Adverse effects of excessive pineapple consumption. Oral irritation. Pineapple contains bromelain, a protein-digesting enzyme that can cause itching, burning sensations in the mouth, tongue, and lips if consumed excessively. Bromelain can soften tissues, leading to a burning sensation or even mouth sores with excessive intake. Solutions: limit fresh pineapple consumption per serving. Soak pineapple in diluted salt water for 5 to 10 minutes before eating to reduce bromelain's effects. Combine pineapple with protein-rich foods like yogurt to lessen oral irritation. Allergic reactions or hypersensitivity. Some individuals may be allergic to bromelain, resulting in symptoms such as itching, rashes, swelling of the lips and tongue, dizziness, and shortness of breath. Those with pollen or natural rubber, latex allergies have a higher risk of pineapple allergy. Solutions: if you have a history of allergies, try a small amount first to check your body's reaction. Stop eating immediately if allergic symptoms appear, and consult a doctor. Gastric and digestive irritation. Pineapple's high acidity can cause heartburn, acid reflux, or stomach pain, especially in individuals with gastritis or acid reflux. Its high fiber content may cause bloating, diarrhea, or abdominal pain if consumed in large quantities. Solutions: avoid eating pineapple on an empty stomach to prevent gastric mucosa irritation. Individuals with stomach pain or acid reflux should limit pineapple consumption and avoid concentrated pineapple juice. Effects on pregnant women. Bromelain can soften the uterus and potentially cause uterine contractions, leading to miscarriage or premature birth if consumed in large amounts during early pregnancy. Some pregnant women may experience digestive upset or allergies from pineapple. Solutions: pregnant women, especially during the first trimester, should limit pineapple consumption or consult a doctor before eating it. If consuming pineapple, limit intake to less than 100 grams per day and avoid frequent consumption. Blood sugar impact. Pineapple has a medium to high glycemic index, GI, twice 59 to 66, potentially causing rapid blood sugar spikes if consumed excessively. Individuals with diabetes or insulin resistance need to control their pineapple intake. Solutions: diabetics should consume pineapple in small portions, 50 to 100 grams per serving, and combine it with protein or healthy fats to slow down sugar absorption. Opt for fresh pineapple instead of juice, as juice has higher sugar content. Oral health effects. Pineapple's high natural acidity can erode tooth enamel with excessive or frequent consumption. Tooth sensitivity may occur if eating overly sour or unripe pineapple. Solutions: avoid holding or chewing pineapple in the mouth for extended periods. Rinse your mouth with water after eating to reduce the acid's effect on tooth enamel. Drug interactions. Bromelain in pineapple can affect the body's drug metabolism rate, particularly blood thinners, warfarin, aspirin. Pineapple may enhance anticoagulant effects, causing bruising or prolonged bleeding. Antibiotics, amoxicillin, tetracycline. Pineapple may increase drug absorption, leading to stronger side effects. Pain relievers or anti-inflammatory drugs, NSAIDs, may increase the risk of gastritis. Solutions: if taking medication, consult your doctor before regularly consuming pineapple. To enjoy the benefits of pineapple without experiencing any adverse effects, moderate consumption is recommended. A healthy individual should consume 100 to 200 grams of pineapple daily, approximately 2 to 3 slices. If you have digestive issues, diabetes, or are pregnant, limit your intake to under 100 grams per day. Avoid eating pineapple on an empty stomach or right before bedtime. Now that you're aware of 6 fruits that may exacerbate leg cramps, consider eliminating them from your diet and observe the effects. Have you experienced this issue? Share your experience in the comments below. And if you're interested in learning about foods that alleviate cramps and improve muscle health, don't miss our next video. Subscribe and hit the notification bell to stay updated on helpful health tips.